artificial intelligence and big data, the game changers.
Hello, everyone, and thank you for the loud round of applause despite your numbers. I really appreciate it. It is a very interesting topic, and hopefully they can hear that the event has now started again. But look, it's very normal when there's a coffee break, right? We just have to get on with it. Thank you to Julia. Like she said, my name is Rachel. I'm a MENA healthcare journalist based here in Dubai. And we're about to talk, some big data, the game changers. So, look, I'm not going to spend so much time introducing each and every one of you. You guys are very well known in the field. Obviously, there's LinkedIn as well to kind of look up your backstory, and I'd rather just kind of get into it. So, first things first. Past year, past the ChatGPT hysteria, I would say a lot of people, we didn't really take AI seriously, I would say maybe in media. Yes, we know what it was, but as soon as ChatGPT came and, there's the threat of, they're going to take all our jobs and we're all doomed and we're all going to just live like Wall-E. But we realized that that's not the case. So, Alex, I'm going to come to you first. I just wanted to know, how has the perception of AI and big data evolved over the past year, past this ChatGPT hysteria? Where are we now, right now? And obviously, I'd want to know in terms of healthcare, how is it evolving? What's the perception in your fields?
Okay, so first of all, I will share with you 3 insights from 3 reports. First of all, there is a report from the World Health Organization on nursing. And this report looked previously the pandemic, stating that at that time there were 5.9 million nurses short of the need. And the projection by 2030 is that we need 13 million nurses. And the number of doctors was estimated of around 4 million. So these were the gaps pre-pandemic. This year, World Economic Forum recently published another paper stating that today we lack 15 million healthcare professionals across the globe. And the projection by 2030 is 10 million gap, including the generative AI impact. So there are so many jobs in healthcare that we need that even with generative AI, we will not be able to cover. So we need to have a different solution, and maybe we'll get to talk about that, because that's about preventative care and education. And when I speak of education, like I recently spoke with Philippe, it's not only about educating healthcare professionals, but also educating individuals or patients.
100%. So is it safe for me to assume that you all agree that we will still require human oversight no matter what? Yes? No, nobody disagrees. All right, cool. Dr. Sven, you had something to say on this?
Well, I just wanted to add, because I just come back from the US, and the numbers say that within the next 3 years, 50% of the nurses will retire. So I completely agree with what Alex was saying. And I think that there's even a more broader theme around it, because what we are doing globally is sick care. We are actually caring for the people who already went sick. So we are not doing preventive care, as you just mentioned. That means not using AI and not using digital tools is not an option.
If I can add, and to take from what you said, there are some reports stating 59% of the medical professional understand that technology will change healthcare. So that should be good. Actually, it's not, because 70% of the doctors are already overwhelmed and see technology as an additional challenge. So just have in mind that around 80% of the doctors thinks that things will get worse, not better, and 1/3 of them want to leave their jobs for new ones or to get out of the system. So this is the reality.
Yeah, just to add on that, we started with nurses, now we talk about doctors. I think the trend is unfortunately the same. So we have not enough healthcare professionals, and we have more and more aging population. And of course, it's a big topic here about, also longevity, health span, and all that. But we are in the early phase of that. So the gap is becoming bigger and bigger. We have more and more people aging, needing care, and we have less and less professional providing care. And it starts, as you said, already even in the school. So I have at least the numbers from the US, from UK, from Switzerland, that 30% of the medical students are not going to start in the profession. So the gap is becoming bigger and bigger on top of what you said about the aging of the healthcare professional, because you mentioned the nurse, the same happens with GPs. We have 50% of GPs in countries like the US or France, they are going to be retired. And there are no younger doctors to fill that gap. So the gap, I think for me, the whole healthcare system is on fire. And how long are we going to continue to watch that? And even, I think for the moment, we even take the wrong decisions. We're putting even accelerant on the fire. Like you cannot have an appointment for GP. You have a flu. You cannot go to the GP because there's no appointment. You should go to emergency. So you go to the emergency room who is already overwhelmed because you have a little bit of fever and a throat pain. So somewhere we go completely in the wrong direction, and we increase the problem rather than solving the problem.
Yeah, and I mean, look, to be fair, physicians, they've got a hell of a lot to do. Plus insurers, here in the UAE, for example, we're privately insured. That's a whole lot of another ball game. So it is interesting that technology is putting off people from practicing. But maybe that's a conversation that you guys can have in your own companies, or maybe you can reach out to universities or schools and kind of show them, actually, no, technology is not going to wipe you out. We still need human intervention. So I know that you're all from different parts of the world-ish. I know India, Pakistan, and Europe, I believe, if I'm not mistaken. We heard, obviously, the regional perspective earlier on from Dr. Khulud from Dubai Health Authority, and I just wanted to know, in your parts of in the world, in your view, what has been the most significant breakthrough in AI in recent times? Dr. Hema, can I come to you first?
Yeah, so in India, if you see that most of the peoples are standing in queue to go to any hospitals or something like that, because the population is very high. This is one thing. Second thing is, like, if you go inside to the clinic and if you want to take the doctor's advice, in that also they need to see the old records of the patient, and it takes much time for that. So in that case, we have been working on the predictive analytics, especially we are customizing all those things and give only the insights of the patient from the past history, what is they happen, and what are the diseases occurred to that particular patient, and currently what is happening, what is the blood glucose, is the patient is affected by diabetes or not. So all those past records will be there in the dashboard, which we created using a Power BI. So that helps the doctors to understand the historical things about the patient, and it takes a less amount of time to predict the disease and can give a solution to the patient. This is one thing which we make the patients not to wait for so much time in the queue. Second thing is, like, many people in India are poor. They can't offer that much of money to pay for going and seeing the doctors. In that case, where now many of them are building apps, especially. But when we come into Voxen, we build an app especially for diabetes, where the person who born, and from born stage they have diabetes mellitus type 2, I think so, that's the disease. So in that case, if a patient continuously want to monitor the blood glucose level, those kind of things, where in US, University of St. Thomas, his name is Professor Manjit Reggie, he has done the research, and he mentioned that we can keep some sensor in the body, automatically it will measure the blood glucose level. So when we discuss about that, he suggested me that can we build an app so that the glucose, based on the glucose level, it will tell the patient that now what kind of food you should have, and the nearby hotel, in which hotel that food you can get it. So this kind of make the things simpler to the patients. We have built this one also.
Yeah,
sort
and,
of.
and that's a brilliant use of data in general, in terms of wearable technology.
Yeah.
And obviously the nuance here is that in different parts of the world, for example, in the Middle East and North Africa, it's so different between the GCC and Egypt, for example, where smartphone adoption even isn't, there are differences in adoption rate. So it's also getting patients to understand how to use, or
Yeah.
do they even have
So
the app?
As we are from education sector, so what we are done at, we are giving we are taking short-term courses, especially for the poor peoples in the area of we have sustainable development goals, where in that we have a lot of goals, 17 goals we have. So based on the no poverty and no education, those kind of things are there. So according to that, we are pitching to the rural areas and we are guiding them how to do that. And also in India, we build an app, especially using a chatbot. We are not use ChatGPT. We build on our own chatbot, where because especially people's doesn't know what is the main use of medical insurance. I just want to say this. So in that case, the government also offered a lot of free medical insurance for the poor people. So to understand that, we created a chatbot in their regional language where they can speak and understand what kind of plans are available in the market and how they can use it and how can get it from the government at the free of cost.
Yeah.
So like that, from education sector, we are pushing much hard to get these things to be reached to all the people in the society. That's what we do.
So we've spoken predictive analytics and wearable data from wearables. Are there any others that you'd like to highlight? Maybe Shaukat, I'd like to hear from you.
Yeah, thank you very much. We operate in 3 continents, in Asia, Africa, and United Kingdom.
Brilliant.
And I think one of the important parts in AI and data science, which we have observed as a research university and a health system, is that now our focus should not be on whether we should be using data and AI. I think the focus should be on where we can bring additional value by using these technologies.
Yep.
I think the research says that it's not a complete replaceable, that you can replace human beings, but what we can do and edit value with by using technologies. So I think in our part of the world, because we are in the top 1 universities in the world and one of the best in the areas where we are operating, one of the best things is that how we can ensure the reach to the far-flung areas. And that's where the use of technology. I can only give you one example. During COVID, the first COVID patient came to our hospital in Pakistan and also in Kenya. So the entire country was looking at the experience of how we dealt with those things and how we can leverage those things. So we in no time, we set up the tele-ICUs, where 10,000 medical specialists were connected with our ICUs to get the best practices about how we can leverage those experiences. I think that's the power of technology. With regards to AI, we are in our multiple campuses. We have connected the APIs of GPT, and now we have our university chat GPT about the university as well. And we are using a lot of these technologies on the digital the diagnostic support system, the clinical support system, and also putting the entire roadmap for our future based on all the data. We have one of the largest language models in LMIC context. I think what is important here is that all these technologies which we are talking about, this is North American, European, and a lot of those data, because the programmers are from those areas.
Yep.
What is important is that inclusivity of all these other regions which are not part of the entire ecosystem at the moment, and that's where we are contributing towards.
We're going to get to that very shortly.
Yeah.
But just very quickly, I mean, we've had predictive analytics, wearables, and obviously the concept of healthcare equity. Do we have any others, just very quickly, as I want to go into really delving into it?
I just would like to add something in terms of, I see 2 axes, to use AI. And we talk a lot about all the, R&D, finding new drugs, new molecules and all that. That's okay, that's great, But we are today stuck in a lot of administration and everything. And we should not forget, maybe we can release some time, some resources by doing simple things stuff. You know, using ChatGPT for email, for presentations or whatever, so that you have more time to do the more complex stuff. So I think there are two axes. You know, there is also the nice things that you cannot do today, you know, that maybe it's promising, there are a lot of opportunities, there's quantum computing coming and all that stuff. But they are simple things which take a lot of our time on a daily basis. And that one could also be solved with AI.
Yeah. Yeah, sorry, Alex.
Okay, I just want to add another perspective, because you see, we are all today to discuss about innovation, but innovation comes in two ways: incremental innovation without deeply changing the system, but just improving certain use cases like we discussed so far, including administrative options. But there is also another perspective for innovation, deep transformational one. And I'm one of the crazy ones to believe that we can build a new paradigm for healthcare. As long as we focus and understand that the solution is preventative care, we will understand that we will need to bring health data sovereignty, so health data under the control of the individual. And this will be a deep transformation for everything around. We speak about generative AI. What is generative AI for you? And I shared this vision in Davos a few weeks ago when I said, think of Star Trek, think of Lieutenant Commander Data. That is Gen AI. That is ChatGPT. It's a bridge between humans and machines. And this will empower a big transformation around preventative care.
Dr. Sven.
I think the beauty from this panel is I think that we are all from different countries in the world. And what I hear from India and also from Pakistan is very inspiring. If I look at Germany, where I'm from, yeah, we either have, you know, automotive engineers or poets, and there's nothing much, you know, besides it. That's basically what you have. So that means that the healthcare system is still being looked at as being good. It's horrendously expensive, probably the second expensive one after the NHS and the US. But people still believe that it's a good system. So they are actually not using AI. So they are not even thinking about it because they are saying, you know, we could do it until here without AI. So we will also be able to do it in the future, not using AI. And that's kind of the exactly false negative thing where we really need to be careful, because AI is just not another thing on top. As you just mentioned, you know, AI is the ability of AI is actually to reduce complexity and drive simplicity. And I think that's what we should use it for, especially in healthcare.
100%. Now, so we're actually in, you know, you guys have mentioned some of the advantages and what's been happening in healthcare transformation, and also you've touched upon the challenges and what we're facing. I mean, truth be told, let's say regulatory bodies still have a lot to catch up on. The technology always comes first, right? And then people start freaking out about it. Even though the recent World Government Summit, which was held here, you know, there is still, Sam Altman from OpenAI was talking about how regulation is required, but it's at different speeds in different areas. So given that no transformation comes without its fair share of challenges, what are we doing right now to involve the public sector, so the government and whatnot, in encouraging, you know, the use of AI for the future of preventative medicine? I know, for example, in Abu Dhabi, precision medicine is on their radar, and so the data is being used from the Health Information Exchange for that in the future. Do governments frustrate you in Europe or in India? Like, what's the deal?
I can jump on that one because, you know, that's also why I'm coming more and more often to the region here. I get frustrated in Europe. You know, align 25 countries, talking a lot, you know, and it's going to take ages before you get this alignment. And I just have the feeling the dynamic here in the region is completely different. And it's not only different in terms of region, because as you just mentioned, Abu Dhabi, Dubai, there's Saudi, there's a kind of competition, and that competition is healthy. That is a healthy competition to move on, not to stop it. While in Europe, the discussion is always like many reasons why you should not do it. And you can talk, I say, for ages, and 25 countries, they are all different, you know, France, Germany, Italy, you name it. So I'm saying, at the end, healthcare is still something which is in the country's sovereignty. So you cannot impose other countries to do the same. COVID was a great example for me, a bad example. I'm living in France at 10 kilometers from Germany, 10 kilometers from Switzerland. When you went out, you didn't know which paper you have to show at the border because all three countries had different rules, different guidelines.
Yep.
That's what it is, you know. So, and I'm not saying it's wrong, because I think none of the country will delegate this responsibility to the neighbor or to another one. But here you have that too, but you take decision and you do and you decide. You know, the government is involved to make regulation. They talk about it, they do it. Now we can come to the point that for those regulations for AI, you need AI. Because the volume of data, the volume of decision is not something a human brain can do alone. So you will even need AI to do the regulations and put this framework in place.
Yeah.
May I add something? First of all, I don't believe that we should regulate AI. We should regulate AI use cases. The second thing, I can share the perspective from Europe and the US. And the regulation system is not only about AI. It starts in Europe with the GDPR as the principles or the foundation. And then you build on top with the European health data space, which regulates how health data moves. And health data being the foundation for AI, we have on top in Europe the AI Act, recently published. On the other hand, there is the over-regulation can, create big challenges for innovation. So you need to be very smart in balancing regulation with empowering also innovation. Mm-hmm. So we see the same in the US with the Cures Act and the regulation for AI to be very soon put into place. So what I want to say is that I would not focus so much on thinking about regulating AI, but on very specific niche and use cases.
Right, okay. Dr. Sven.
Well, I think your initial question was on policymakers and regulation. And I think policymakers and regulators are always kind of a mirror of the population of each country. So as I a little bit on the funny side told you about Germany, I mean, what we don't understand, we either want to regulate or ban. I think we were the second country after Italy to ban AI. We didn't do that at the very end, which is okay. So that also means that there are obligations and also there are responsibilities, not only on the regulation side, but also on the AI side, to prove why we should use AI. And I think this is a bit what Alex mentioned in terms of you need AI to regulate AI. So I would probably phrase it a bit differently, is that AI should show us why we should use AI because of the value it brings. I think if AI is not able to show the value, we will have an issue anyway. But I think what we can achieve is, and I make an example from the medical field, there is something that called explanatory AI, and that basically shows you when you look at a picture, like an MRI scan or a CT scan, the AI says, I think I detected a nodule or a tumor, and I will show you in the picture the pixels that actually brought me to that decision. And then you can decide yes or no. That builds trust. And I think when you have the trust, you will also use it. And I think that will be very important for regulators and policymakers to have the background of saying, okay, there's always kind of a, why did I actually do it?
Yeah. So I have to go into data, which Dr. Him, I'm actually going to come to you about. We're gathering all this data at the moment. Private sector's gathering its own data, so wearable companies, apps, whatnot. And the government is also collating data through its health information exchange, etc. Now, I do have to come to the point of the ethics in AI and insurers. So you've mentioned, obviously, look, it's no secret that a lot of data is based on research that's conducted on white men. That's just what history tells us. It's changing, but that's the fact of the matter. And obviously, there are researchers out there right now that are trying to diversify the data that we're working from. But at the moment, let's assume that AI is kind of pulling the proven data that we have right now. So there's that one thing. How do I know, for example, if my background, I'm not white, and I've gone to a doctor and it's predicting something that would apply to person of a certain race, but not to me. That's one thing. The other thing is, if we're talking about genetic screening, which is also ties into data collecting and precision medicine in the future, if I do a genetic test and it comes out, for example, that I'm at risk of contracting, not contracting, but I'm at risk of developing breast cancer in the future, I'm privately insured. Is that data going to go to my insurer now and say, actually, hang on a second, it predicts that you're going to get cancer at the age of so-and-so, so we're going to raise your premium? Like, how do we control this data so that the wrong people are not taking advantage of it?
I want to answer to this. First thing is, data plays a crucial role in this. So when you train any model, the data should be validated first. And validation can be done only through humans. So that is more important here, because we cannot trust AI as it is, that the human intervention is must to verify it. This is one thing.
But what if the humans are biased?
Human robots.
What if the humans are biased?
So humans are not biased, because when you think about, if you take only one person to consider about it, then it is a issue in that. But if you form a regulatory body where if 5 to 10 people in the group, and if they are doing kind of verifying all those things and standards according to the model which you are building up, then it is fine. I'm not saying about one person. It can be like a team of members as a regulatory body should do that.
Shaukat.
So I think it's a very, very good question. If the humans are biased, right? And it's not, and you are absolutely right that it's very important to understand that maybe they don't understand the perspective. I can give you a practical experience. We were rolling out an electronic health record, and we have developers from US and South Africa. When we were asking them for certain requirements, they were not connecting those because they cannot visualize these problems. And same goes for AI as well, right? All those developers who are developing all these algorithms, they cannot contextualize the ethnic differences of the backgrounds where many of us are representing at the moment. And that's where actually the potential is. And that's where the universities like us, who have a health system and a university, can bring some value by partnering with those international institutions. Because what is important is that even though the developers are not biased, but they don't have exposure of that context. They don't have this diversity of dealing with the population who are in far-flung areas in Africa or South Asia, and those people, and how they are grow up, what is their diet and everything. So I think that's where I think the important part is these collaborations.
Yeah, 100%.
I would like to add something. I think that's exactly the point. For me, what you ask is not a problem. I think it's an opportunity with the new technology, because as you mentioned, it's already biased today. And I think we can do it better by being aware and using technology to do clinical trials and all that, and being aware of what the bias and avoiding the bias. Because I said today, it is biased. You can talk about women's health, which is another huge example in that area.
100%. That's another conversation for another day. We have 3 minutes left on the timer, and obviously I'm very conscious of time. I don't want to overrun. This is a huge topic. It's impossible to cover everything, cover all the bases with 5 brilliant people from different parts of the world. Dr. Dillon, please set up an AI conference, just an AI conference on its own here, because it's much needed. But look, I'm just going to end it with one thing. The title of our panel is AI and Big Data, the Game Changers, Unlocking the Potential of Tech in Revolutionizing Healthcare and Industry Insights. You guys are going to be around, and our lovely audience they're happy. You guys are all happy to be, to be grabbed later on to have a chat. But if you want to just leave this stage having offered one piece of advice or just one thing you'd love the audience here to know, what would it be? And I'm just going to go in order. So, Dr. Hema, would you like to start? What would you like the audience to know with regards to this huge topic?
Yeah. So, I'm from Oxford University and the director of AI Research Center. And in our center, currently we work on 2 main projects. One is neck robotics, where we use the dead spiders, making into a nanorobots, and we use for the medical purpose. This is one of the projects we have been currently working on. The second one, we are using metaverse for the virtual specialty hospital. So if anyone likes to collaborate with our AI Research Center, you're always welcome. We can collaborate and jointly work together.
Ooh, very smart. All right, Dr. Sven.
Well, I think on the more, let's say, broader level, I would say it's about the adoption of AI will be based on the integration of the AI into the workflow. Otherwise, it will not be used. So think about the workflow, think about the value that you will create, and I think then AI can actually be a game changer.
Very valid. Shaukat.
Yeah, I think I'm very clear about one thing, that AI and big data, this is going to stay. This is not like coming for 5 years or 3 years and it's not going away. I think the important and smart move on a country level, institutional level, and also individual level is about learn the potential, about how you can cope with your experience, how you can leverage these emerging technologies in your institution, in your country, and as an individual person. So I think dig into it, collaborate, and then use the best use of all these technologies.
Perfect. Alex.
I believe that building AI in healthcare is very different from any other industry. Why? Because in healthcare, the data is scattered, siloed, and sparse. And there is only one way to build really personalized AI, only by empowering individuals to aggregate the data. There is no other entity legally capable of doing that except ourselves. So I believe if we really think that we can build AI, we need first to change the paradigm to empower individuals to take back control over their health data.
Take back the control. Philippe.
And for me, the last point would be, you're lucky. I have a lot of lights. I don't see everybody, you know.
They look beautiful.
You know who has really used AI? Get some hands-on here in the room. You see,
Yeah.
still a few hands. You know, sometimes depends on the audience as less. But I think we should all try it. You know, I still have the feeling we have too many people talking about AI and they have not tried it. So give it a try, get some hands-on, and then you might have a different opinion.
100%. And please, guys, don't use ChatGPT to write your LinkedIn posts. We can tell. So thank you very much, gentlemen. It's been a pleasure to have you again. There's so much to cover, and thank you so much for being here with us. I just wanted to let you know, if you are on the social media, please be sure to use the hashtag MTWDubai 2024 so we can catch up with what you guys are doing. In the meantime, please join me in thanking oh my God, I'm doing the German one now. Philippe Gerwill, Alex Diaconu, Shaukat Ali Khan, Dr. Hemachandran Kannan, and Dr. Sven Jansen. Thank you very much, gentlemen, and thank you for being here with us.